Mwenzi, as head of the science desk here at the Nation Media Group, do you feel we've failed in our job to create awareness around this issue? Or is it because of the nature of what we're dealing with that we're where we are?
I don't think we've failed. I think we've struggled. But I don't think we've failed. Because if you listen to what the people on the streets are saying, people from various parts of the country are saying, they are aware that we have this mess that we are struggling with.
Yes.
They are aware that we have a virus in our midst that we don't know how to deal with in the first place. I think the problem has been that the flow of information, especially at the expert level and at the government level, has been lacking. We as journalists have tried our best to tell this story. We've contacted government agencies. We've done our own background research into these things. We've talked to students as far as China, who are stranded there.
Yes.
We've tried to bring this story closer home and to paint a picture about what is happening around the world. Now, for a story that is happening hundreds of thousands of kilometers away, and we've not yet, managed to isolate a particular case here so that we can really pinpoint and go directly and say this is the story that we are going to focus on, it's a bit challenging. It's a bit challenging, but it still has to be told. So
we haven't failed, but we are struggling. Eunice?
I think we've tried as much as we could to tell the story of coronavirus or COVID-19. However, as Mwenzi has just stated, getting the flow of information, because most of the time we had to rely on regurgitated statements from, some of the experts and mostly the Ministry of Health. It's just the same old template. There's nothing new. And at times, telling that revised or telling the story over and over again without anything new, I think at that point we get to lose our audience. They're like, did the same thing, like you could hear people saying ugonjwa ya China. And I think the connection between the Ministry of Health and the journalists to try and make it seem important or look important to Kenyans, that one has not really come out properly. Then another thing in terms of health, per se, health is a devolved function. And as the sound bites were from the different counties. Initially, the Ministry of Health had stated that they're in communication with various heads of health in
different counties.
Every county. It ended there. What next? Are we doing communication to the people? Are we telling the stories to the people? Are we sensitizing these people, or just getting communication from Afia House or the Office of the President when they have the presses? So I think getting that information and information that these people can consume, easy for them to chew, I don't think we've really gotten to the people.
Right. And from a scientist perspective, when you saw the news, when you've been watching the news, monitoring it, what comes to mind? Do you feel disappointed with the work we're doing?
Not at all. Actually, I think the press, just like many of us in science, in the government, is struggling with a dearth or the lack of information, that we do not know enough about this virus to give as much information as we should. And from the clips we saw of the county, from the counties, we can see that people have many questions. They want to know, how is this thing transmitted? How is it? How prepared are we? It's like you want somebody to keep reassuring you every time. And although we've not been quiet, there is very little new information that has reached the person who needs it. So I think although the media has actually done a bit of sensitization, there is primarily a lack of enough information on this virus. And that's our biggest problem. Of course, we know about coronaviruses. We know how they are transmitted. We have an idea. But this being a new virus with a lot of mystery surrounding it, that could be playing against us. So I wouldn't blame the government as such. I wouldn't blame the media. And in fact, I would say the media has tried over the last few years to have specific journalists for covering such issues. Previously, I think you just used to send them, the person is available. Yes. now we've seen an effort to make specialists or people who are focused on these things, and that helps. The other thing on our side as scientists, we've not been very good at communicating our messages in an appropriate language, that
layman's language,
that somebody can understand. In fact, many of us are media shy. We tend to hold information until we are totally sure. We've done the experiments twice, 3 times. We know when we're going out this is true, whereas the public wants something every day. So there is I think, a middle ground here, that the now specialist journalists can coerce more scientists to come to the forefront and communicate a message in a language that the public will understand.
Shiro, right now, Shiro, you're not just with a local audience, but Pan-African audience that you're working with. And as you cover this, are there misconceptions that you see? And is it important for us to get to the actual definition of this, even though we're not the medical experts and even though we're wrapping our heads around this?
You see, we exist in a digital world, so the function that the traditional media had previously of breaking news has been taken away from us. People, first and foremost, are getting their information from social media. In the clip we just viewed, there were a couple of people that were saying, nimeona kwa mtandao, that, you know, this is what is happening, people are dropping dead in the streets. So, you know, when you asked, are we failing in our function? I don't think we're failing, but I feel that we could do more in terms of fact-checking, because there's this saying that, you know, a lie will travel 1,000 times before the truth has time to put on its shoes. We are the truth that is putting on the shoes, and I think we're putting on our shoes too slowly. For instance, if we see information online, screenshots of tweets that are frankly quite alarmist, it is our responsibility as a media to contain panic. And, you know, there are all kinds of misconceptions that we've seen that I'm sure we'll be unpacking throughout the show. But various things like, you know, if you smoke marijuana, it contains the coronavirus symptoms. I'm sure a lot of people will be greatly disappointed when they find out that is not the case. We found out that certain governments, like the government of India, for instance, fell victim to misinformation, spreading things online to the effect that homeopathic remedies are effective against COVID-19. So no one is immune, but it is our responsibility as a media when we have this platform and we have access to peer-reviewed information, we have access to official information from like trusted and reputable organizations like the CDC and the WHO. We have scientists right here like Dr. Masika, who is more than capable of debunking such things. So I feel like we should be acting as a media in a more timely fashion to debunk a lot more of these things before they spread like wildfire.